Hello everyone. Welcome to Patients' Rights Education Project, PREP, your #1 online patients' rights education program. We are reaching you from Ebenezer Egwuatu here in the capital city of Nigeria, Abuja. My name is Ebenezer Egwuatu. I am a patients' rights advocate and I am also a legal practitioner. The aim of this program is to educate and sensitize you on your rights as patients. I mean, when you go to hospital, you have rights. So that's what we are here to talk about. By the way, let me ask you a few questions. Have you ever been to a hospital to receive treatment? Do you know anybody, either your friend, your family member, your brother, sister, uncle, relative, neighbor, colleague in the office, who has ever sought health care in hospitals? If your answer is yes to that question, then stay tuned because this program is for you. Now let me ask you another question. Have you ever heard of patients' rights, as in the rights of patients? Well, yes, it's possible you have heard it in the past. Do you know your rights as patients? That's also what we'll be discussing in a few minutes. So, call your friends, call your neighbors, call your brothers. It is prep time. Good. What are the rights you have as patients? Firstly, let's start with what is patients' rights. It is simple, as the name implies. This is not a classroom setting, so I do not want to go into technical academic definitions. No. Patients' rights are those rights you have as a patient who is seeking health care in hospital. As simple as that. So you are saying, you mean I have rights? Yes, you do. You have rights. Let me tell you, you have a right to information when you go to hospital. The information starts with the doctor introducing himself to you. My name is Dr. XYZ. Then he tells you his qualifications. Okay, I am a trained or a consultant gynecologist, I'm a consultant pediatrician, I'm a consultant oncologist, I'm a consultant whatever. Now, what that does is he relaxes you, makes you to understand that you are not in the hands of a quack. You are dealing with a professional. He might tell you, I have been in this job for 10 years, 20 years, 30 years. Now, where the doctor fails to provide that information, it is your responsibility to ask. You remember the time you went to hospital, you filled the form, you gave them your name, you gave them your particulars, including your height and age, and whether you took alcohol or not, and all that and all that. You have a right to ask the doctor a question. Sorry, doctor, sorry, nurse, what is your name? Now, do you know why you are asking that question? In case anything goes wrong, we know who to hold responsible. Now, we are not praying for anything to go wrong. We are just saying if anything goes wrong, you can say it is Dr. XYZ that treated me. Because with time, you will get to know that you have a right to lay complaints. You even have a right to reject treatment. You have a right to refuse treatment. But we will tell you how that right applies and when you can invoke it and how you can use it. It's your right now, so you use it. So part of your right to information is that you have a right to be informed of the nature of ailments that you're having. What's the nature? Okay, it's not you now, assuming the person has cancer or ulcer. What type of ulcer is it? They will tell you. If it is headache, what type of headache is it? They will tell you. If it is stomach ache, what is it? They will tell you. Now, after telling you, they will also tell you the treatment options available. I didn't say treatment option. Treatment options available. If it is what injections could take care of, if it is what taking drugs could take care of, if it is what just exercising could take care of, if it is what a procedure, meaning operation, surgery could take care of, they will tell you treatment options. Then after that, you make your choice. You say, okay, this is what I want. As they are telling you the treatment options, they could also tell you the financial implication. So that you don't go and choose one treatment option that you cannot afford the cost. So they will tell you. These are all part of your rights to information. Your right to information includes that you should be informed in the language you understand. What that means is where the person is unable, the patient now is unable or does not understand English language. The healthcare provider is supposed to bring this thing down. You know, there are hospitals you visit, you interact with doctors, you will come out and you'll be asking yourself, did you ever go to school? Because they will just scatter your head with all these their medical terminologies. You are suffering from angular stomatitis. What's the meaning of that? Now, let me tell you a story, a true life story. My uncle was hospitalized in a particular hospital somewhere in the southeast of Nigeria. That should be 2010, yes. I was nursing him in the hospital for 3 months. I was with him in that hospital. Then one big Ogbonge consultant like that now came and made a prescription. We looked for that prescription in Umuahia. We didn't find it. We looked for that prescription in Aba. We didn't find it. We came back complaining. These consultants gathered the resident doctors that were under him and say, you mean you don't know this prescription? You say, no, sir. You don't know this prescription? You say, no, sir. You don't know this prescription? You say, no, sir. This is Andrew's liver salt. That's what the man said. Honestly, I was angry. We have spent transport from about to Umuahia can buy 1 carton of Andrew's liver salt. So, assuming someone has HIV/AIDS, or even the dreaded coronavirus, that's what the test result shows. And the person is passing. Dr. A tells Dr. B, see that woman that is going, she has HIV. That's unprofessional. They are breaking your right to confidentiality. Your medical record should be confidential. Then there are cases where people engage the services of house helps, be they male or female, and they subject them to all kinds of tests, hepatitis B, HIV, hepatitis Q, whatever test. Fine and good. It's fine. It is for the safety of your children and your family. I even encourage it. But then, after you have done all these tests, madam, please, let that house help know his or her test results. It is his or her right. Ordinarily, the medical laboratory person is not supposed to give you that test, even though you are paying for it, without the consent of that house help. Again, let me use this opportunity to talk to churches who do premarital counseling and tests. I agree, it is fine. I endorse it. But in doing that, because somebody can sue somebody over this thing we are talking and joking about, and it becomes a big legal issue. So when your intending couples come, when they come for premarital counseling, and you send them to test, when they finish the test, tell them to get 2 results. Let the laboratory produce 2 results. 1 to the persons that subjected themselves to the test, 1 to them. Then the second one should now come to the church. It's the same results. I know you will say, if we give them first, they can doctor the result. No problem. It's their body, it's them and God. No problem. But for your safety, to save yourself from legal tussle, it's just wisdom that is profitable to direct. Produce 2 results. Because tomorrow, if the person comes and says he did not consent to his result being given to a third party, Wala has come. How do you prove that he did not consent? How would you prove that he consented? Those will be issues of law. But simple instruction, 3 sentences, 4 sentences, 5 sentences. I beg, laboratory technician, when you finish this test, produce 2 results. Let them also know. If possible, you can take it a notch higher by drafting a consent form for them to sign. I consent that my test results be given to my church or to the marriage committee, or to then let them sign that form. You put it in the file. It doesn't cost much now. You save yourself plenty wahala. You know why I'm saying all these things? The world is evolving. Any little thing now can become a big legal issue. By the way, any church that does this, don't fail to come and pay me for this free consultancy. So, let's make progress. You have a right to visitation. We are communal people as Africans. We are, yes, yeah. We are our brother's keeper. In fact, there are places that one man's sickness is the sickness of the whole community, because people will just be bringing food. People will just be coming to greet you. People will just be bringing food, bringing money, bringing beverages. That's how we do it in Africa. Because that love we bring also fastings aids the healing process. You know you are not alone. So when you eventually go to hospital, if it is a sickness that leads to admission, you have a right to be visited by your friends, by your well-wishers, by colleagues in the office, by families. But then, this is your right, It is subject to the visitation rules of the hospital. If the hospital say their visiting time is from maybe 4 p.m. to 6 p.m., my brother, my sister, even if the whole village is coming to visit you, limit them to that time frame. You don't say, Barrister Ebenezer said I have right to visitation. Then you now carry your whole community to be disturbing the hospital by 10 p.m. No, because you have a right to visitation. It doesn't work that way. So you have a right to visitation, agreed. Your visitors must not disturb the next patient, because where your right stops is where that patient's right starts. You have a situation where people just carry their whole community to the hospital because they are coming to visit. Then the chair that had been attached to each patient's bed corner for his visitor, 1 or 2 chairs. Your own visitors that are 25 in number will now go and drag every other person's chair. Haba. No, now. Tell your visitors when they come, let them also respect the other patients in the ward. Thank you. Next, you have a right to transparent billing, open billing. What it means is that as you're consuming the healthcare services, yes, you are consuming it. I didn't mean consumption by eating. As you're receiving healthcare services, there's what we call consumables, like the plaster they use, the syringe and needle they use. These are medical consumables. So any treatment that is given to you, they will tell you the cost instanta, as in immediately. That, madam, we use syringe and needle, it's consumable, okay, it's 200 naira. They will add it to your bill. Okay, there's this procedure, we use catheter, it's 500 naira. They add it to your bill. We use this, they add it to your bill. This surgery costs 30,000, they add it to your bill. That is open billing. At the end of the day, you will know how your bill rose from 0 naira to maybe 200,000 to 1 million. You will pay.